Hello and welcome. Today, we're diving into a common yet often debilitating ear condition, chronic suppurative otitis media, or CSOM. We'll explore what it is, why it happens, how it's diagnosed and treated, and what you can do to prevent it. CSOM, at its core, is a persistent infection of the middle ear that leads to a perforated eardrum and ongoing drainage. Several factors can contribute to its development. Often, it stems from recurrent acute otitis media, especially if inadequately treated. Eustachian tube dysfunction, which can be caused by allergies, enlarged adenoids, or even cleft palate, can also play a role by preventing proper drainage and ventilation of the middle ear. Certain bacteria, like Pseudomonas aeruginosa, Staphylococcus aureus, and Proteus species, are common culprits. Furthermore, socioeconomic factors such as overcrowding and poor hygiene can increase the risk. Let's break down the pathophysiology. The infection begins in the middle ear, leading to inflammation and the accumulation of pus. This pressure eventually causes the eardrum to rupture. Unlike acute otitis media where the perforation often heals, in CSOM, the perforation persists. This persistent opening allows bacteria to continuously enter the middle ear, leading to chronic inflammation and sometimes even destruction of the surrounding bone. This chronic inflammation and infection can also lead to the formation of cholesteatoma, a skin-like cyst in the middle ear that can erode surrounding structures. CSOM is a global health concern, but its prevalence varies significantly. It's more common in developing countries due to factors like limited access to healthcare, poor hygiene, and malnutrition. Children are particularly susceptible, especially those under 5 years old. Indigenous populations and those from lower socioeconomic backgrounds also experience higher rates of CSOM. The hallmark symptom of CSOM is persistent ear discharge, medically known as otorrhea. This discharge can be thick or thin, and may be full-smelling, especially if a cholesteatoma is present. Hearing loss is another common symptom, which can range from mild to severe, depending on the extent of the damage. Ear pain is generally less prominent compared to acute otitis media, but some individuals may experience discomfort or a feeling of fullness in the ear. Dizziness or vertigo can occur in severe cases, particularly if the infection has spread to the inner ear. Diagnosing CSOM typically involves a thorough clinical examination. An otoscope is used to visualize the ear canal and eardrum. A key finding is the presence of a perforation in the eardrum along with signs of active or recent infection. An audiogram, or hearing test, is performed to assess the degree of hearing loss. In some cases, a culture of the ear discharge is taken to identify the specific bacteria causing the infection. If complications are suspected, such as cholesteatoma or spread of infection, imaging studies like a CT scan may be necessary. CSOM can be broadly classified into two main types: tubotympanic disease and adachontral disease. Tubotympanic disease is characterized by a central perforation of the eardrum and is generally considered less dangerous. Adachontral disease, on the other hand, involves a marginal perforation or retraction pocket in the attic region of the eardrum, often associated with cholesteatoma formation. This type is more likely to cause complications, such as erosion of the ossicles or spread of infection to the brain. Treatment for CSOM focuses on controlling the infection, drying the ear, and improving hearing. The first step is usually cleaning the ear canal to remove debris and infected material. Topical antibiotics, often in the form of ear drops, are prescribed to combat the bacterial infection. Oral antibiotics may be necessary in severe cases or if there's evidence of systemic infection. Surgeries such as tympanoplasty to repair the eardrum or mastoidectomy to remove infected tissue and cholesteatoma may be required if medical management fails or if complications arise. Hearing aids can be used to improve hearing loss. Preventing CSOM starts with preventing acute otitis media. This includes ensuring children receive all recommended vaccinations, including the pneumococcal vaccine and the flu vaccine. Avoiding exposure to secondhand smoke and breastfeeding infants for at least 6 months can also reduce the risk of ear infections. Prompt and appropriate treatment of acute otitis media is crucial to prevent it from progressing to CSOM. Finally, promoting good hygiene practices, such as frequent hand washing, can help reduce the spread of bacteria. The prognosis for CSOM varies depending on the severity of the condition and the timeliness of treatment. With appropriate medical and surgical management, many individuals can achieve resolution of the infection and improvement in hearing. However, some may experience persistent hearing loss or recurrent infections. Recent research is focusing on developing more effective topical antibiotics and exploring new surgical techniques to minimize complications and improve outcomes. Additionally, efforts are underway to develop and implement community-based programs to improve access to healthcare and promote prevention strategies in high-risk populations.